If you didn't get to make it to the convention, AMSN is extending the convention experience all the way through November with the virtual convention extension. Check it out on the website at amsn.org.
On this episode of Med-Surg Moments,
how to care for dementia patients and our AMSN convention experience.
I'm like, let me text Sydney where she is.
And I kept saying, I can't find Maritess. I haven't seen Maritess anywhere.
And then there she is. She showed up like
When I arrived, I felt the love.
It really just reignited that spark of me and my nursing journey.
And he was like, you're going to go alone in a boat.
You're not alone if you feel like this patient population is really, really hard to care for.
In the next 10 years, there will be more people getting outside. Do we have the right training, the medications, how it affects?
And this particular patient was in early stages of dementia, but her family members were very...
Sometimes I think they don't want to come to the realization that this is really happening and this is the new way of life and this is how mom or dad are going to be.
Nurses don't like to admit that we get frustrated or upset or even sometimes angry with patients.
Sometimes I need some real life solutions because I've got 5 patients I'm trying to take care of. I've got calls I got to make.
We gave her a vest. It's like an activity vest where we...
And I said, oh no, my name's Eric. She flew off the handle. Anger, aggressive, oh, get out of here.
She was really desperately asking how can she help her mom. And I said, is there anything that she loves? This is Maritess,
Sam,
Eric,
Marcella,
Kellye,
and Sydney. Welcome to Med-Surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud Med-Surg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
Our topic today is how to care for dementia patients. But before we get started, the AMSN Convention just finished up in Austin, and I, along with Maritess and Kellye, had the good fortune of being able to attend this year. So we thought we'd start this episode sharing our AMSN Convention experiences. Maritess, why don't you get us started?
Thank you, Sydney. And I agree. That was so much fun. The AMSN Convention for this year, I had the opportunity to really meet you guys in person. I'm like, let me text Sydney where she is. And then there she is. She showed up like, like a genie in a bottle. But it's an experience that I always look forward to every year. A lot of inspiring sessions, a lot of networking, a lot of meeting colleagues that are now friends. And then as you move along with every year attending the convention, you get to meet new friends. And it's always fun, always a fun learning opportunity. And again, like I said, the best part is seeing you guys and hopefully next year, going to see Sam, Marcella, and Eric in the convention. How about you, Kellye?
It has been an incredible, incredible experience. Like you said in the last podcast, you said you're going to be hooked. I will tell you, I am hooked. The breakout sessions were very insightful, very inspiring. Like I love that keynote presentation. I'm not limping, but a swagger. We laughed, we cried. We really felt what it is to be a true med-surg nurse in the profession. And she just really, really gave her gratitude to the nursing profession. And I really love that too. She gave a shout out to Shepherd Center, and the Shepherd Center is actually in Atlanta, Georgia. And I know the Shepherd Center's work in really taking care of her, being a stroke survivor, a brain tumor survivor, like that story really, really inspired me a whole lot. And just being in Austin too, this is my first time being at a convention, and the networking was amazing. It exceeded my expectations of a nursing convention all the way. When I arrived, I felt the love just being in the atmosphere of med-surg nurses. When we had the sessions, I ran back to the room, changed clothes for that grand opening rodeo reception in the exhibit hall. You guys, that was incredible. Incredible seeing everybody in their giddy up cowboy boots, their hats. So y'all know I had to dress the part. But just being in Austin, we had a little bit of time to explore the city. Me and a new nurse friend I met, she actually was a nurse manager in the state of Florida. And then another nurse educator, we kind of took some time, explored downtown. We went along the river. We seen the strip where there was a lot of bars, restaurants. It was just amazing settings in Austin. Sydney, what would you like to add?
This was my first convention also. I'm already excited for the next one. I got back to work and I was like, let me tell you about my convention. I just got back from a convention. I had so much fun at the convention. You got to come to Palm Springs with me next year. It was so awesome to meet everyone in person. When I ran into Kellye, and I kept saying, I can't find Maritess. I haven't seen Maritess anywhere. And then the same thing. I turn a corner and she's right there. I know you. And we hugged and we went and found Kellye. We had a great time. And we got to meet up with some of our old podcast hosts, which was awesome. I just learned so much. There were so many amazing presenters and podium speakers. And I'm already like, okay, what do I do to get a poster? What do I do to get on a podium? It really just reignited that spark of me and my nursing journey and how to just give back to this community. What can I do to further these next people that are the first time attendees next year?
Mm-hmm. Being around like-minded individuals, nurses that are passionate about the profession just like us, the exhibit hall was a really, really wonderful way to network. It was a highlighted experience where they opened up the floors to where we roamed around, look at the vendors. We were able to go to booths and run into your nurse colleagues, have conversations that were not nursing related. What do you do in your spare time? What do you do for fun? What does wellness look like for you? And I took the advice of getting my own business cards, personalized cards, where I was able to use my QR code so they can just get my information in LinkedIn and Instagram. And we exchange numbers and just kind of talk about some of the things we're doing in our personal lives and our work lives. And just really, really a good experience to meet other people and be in the rooms with people who are doing amazing things in their career. So networking just ranged from sitting at the table, letting people hear your conversation. Everybody was so involved and so in sync with each other until you were not alone. I came alone, but I left with plenty of numbers, plenty of connections, plenty of friends, different things like that. And I really, really, really loved the fact that everyone was so empowering. The app was a really good way to chat while you're in certain rooms. The app was the best thing that you can add on to a conference experience because you can go in and, talk to the presenters, ask them questions after they presented if you did not have time to ask those questions. So I really loved those sessions. They had random challenges where you win different prizes. Those prizes were amazing.
Kellye, I really like the fact that that AMSN is a resource. It's a wealth of knowledge. A lot of nurses out there are willing to help. And I'll give an example. I was in this project and I wanted to learn more about a specific certification with ONS. And of course, Laura is there. She's an oncology specialist, NPD. And so I said, Laura, I need your help with this and that and that. And she's like, sure, I'll send you information when I get back. And then I met with Monica and we were talking about international nurses, and I have projects and some tools that I can share with her regarding international nurses. And so the networking really doesn't stop with building your knowledge and building that friendship, but also it's really a wealth of resource with everything else. Anyone seen any bats in Austin? I tried because Monica told me, Monica Van Der Zee, she said, if you go by the bridge in that area, you're going to see a lot of bats at sunset. And so here I am looking at the pathway going to the bridge. I saw a lot of people. So I was so concerned. I was like, there's something going on there. And look at me, the nosy me, right? There's something going on there. I hope they're fine. I hope they're okay. So I went there and that's where you actually see all the bats like flying out from the cave. And so I told my husband the next day I will book a tour on a boat. And he was like, you're going to go alone in a boat without anyone else and in public and in Austin. You're sure you can do that. And you're going to see bats in a cave. And it's like, okay, never mind. Maybe next time I need to do it with my family, but going to conventions is learning and also exploring. When you travel, you take away something from that place and you learn and you explore and you become a new person. Not that I'm Batman now, but I started looking at different types of bat. Like, man, there's a lot. There's a lot of them. And Austin has a lot. So next time I will do that. But learn, network, and relax. I think that's the best part too, because you get an excuse for not reading your emails because you're listening to all the sessions.
That is right. So I was going to add on the Friday 6 a.m. morning walk. Y'all know I woke up for that. I woke up very early and joined them with that walk. We stretched a little bit in the lobby area, 6 a.m., 6:30 a.m., and we all gathered and got together and we just walked downtown Austin. The views in the morning were great. It wasn't a lot of people out in the area, so we just really got our steps in. We seen different things, and that's when I heard a lot of the nurses talking about the bat tours. And I was like, oh my gosh, but I heard they had a lot of fun, so maybe next time.
Eric and Sam, we really missed you guys and we wish you could have been there with us. What's new with you?
Next year, I promise. Next year is my time to travel within the state of California. It sounded like you guys had a whole bunch of fun. I saw the pictures. We were updated with pictures and it looked like a blast. Thank you for that. For me, I had like 4 COVID patients. And then I got COVID and I was down for like 2 weeks. And I'm just kind of getting over it. It just really hits me hard. It's my second or third time having COVID. It took me off work for 2 weeks. I'm just starting to get back into the swing of things. So nothing too exciting this time. How about you, Sam? What's going on with you? Anything new?
So I missed out on the last time we all got together. I was out on vacation, rented a cabin on a lake, and we did not have good streaming internet at that time. So I missed out, but you guys held down the fort. The episodes were great. But for us, life is just busy but great. I've talked a lot about motherhood, and I've got a toddler who's very toddlery. He's just hitting like 18 months old, so very quickly approaching 2, which everybody's heard about, even if you're not a parent. So looking forward to that. But Theo is just learning so much. He's talking a lot now, and he's also really taken off with sign language, and that has been really fun new parent experience for my husband and I. So I would say that's mostly what's been going on personally. It looked like you guys had such a great time at convention. I was thinking back fondly of when I got to go to San Antonio in 2022, which is also such a great time too. And so I guess for our listeners, if you didn't get to go either, I don't want you to think that you can't network, because the Huddle, I'm going to put in a plug here for the Huddle. It is such a great discussion board for different ideas. If you're working on any sort of like quality improvement projects, or you just want to read about what other people are doing, or contribute to some conversations of people looking for ideas too. Your workplace may have some really great solutions to some tricky problems that other people are trying to solve. So definitely check out the Huddle if you're interested in kicking off some networking, whether you're bedside, you're a manager, educator, anything like that. I think that's a great way to get started too. So if you're looking for it on the AMSN website, you'll go to amsn.org and it's under the membership tab. You'll see it down there. So the Huddle. So definitely get logged in there, take a look around, and don't be scared to contribute to whatever you find interesting. But yeah, I think that is it for updates, and it's great to be back to see you all.
Well, why don't we move on to our topic? Caring for dementia patients can be a unique struggle. Partnering with families who are scared and overwhelmed can make it even tougher. Today, we're talking about how to best care for dementia patients. Who would like to get us started?
I think I would just start by sharing that you're not alone if you feel like this patient population is really, really hard to care for sometimes. I think about the patients that have been admitted for a really long time because we can't find somewhere for them to go because of their behaviors related to dementia, or those family members that are super burnt out and haven't had a break in years and years and maybe aren't as supportive here in the hospital as we might hope for them to be or need them to be. So I just want to put that out there, that this can be just a really, really challenging patient population to care for. But I think keeping a few key things in mind can be really helpful. The first one I would start with is you have to be able to enter their world. You're not going to be able to pull somebody back out into our reality when they think that they're at home, but they're in their hospital room, or they think that their dog is under their bed, but they're not. And so I think a lot of good experience there and keeping those things in mind as you work with those patients is going to be really valuable. Even though it may be time consuming, it's going to get you a lot farther in terms of being able to actually care for them and help them.
Yeah, I agree, Sam. It is a very challenging population because there's so much information out there and that research is not really that extensive. I'm really more concerned of the preparedness of our nursing community. Are we prepared? Do we have the right training? Do we know really the medications, how it affects our patients? Because those are the things that are out there in research right now. And it is a continuous search of knowledge of what is really going on, especially now there are so many factors involved. Like, does COVID have something to do with this as well? You know, those are factors that are going on. And the statistics are really very alarming because I heard that in the next 10 years, there will be more people getting Alzheimer's, getting dementia if we don't take care of ourselves now, especially with everything that's going on with our environment, the stress level that we have. As nurses, I think we really need to prepare ourselves, to train ourselves, get the information that we need. If you feel like you needed more training with the assessment, because assessment is key when taking care of patients with dementia, we need to really hone into our skills, our assessment skills.
I had a patient with my new nurse, and this particular patient was early stages of dementia, but her family members were very, very reluctant to even accept the fact that their family members was going through the dementia. And out of all her family members, it was sad to see that her one son was taking care of her primarily. He needed a break. And when I was taking care of her, she was pleasantly confused. She wasn't throwing things at you or being a difficult, tough patient, but she was just asking questions over and over because she really didn't understand. So as it got towards 5:30, 6 o'clock, we noticed she started climbing out of the bed. The bed alarm kept going off. We would go in to try to reorient her. She would listen for a little while. The minute we left the room, bed alarm is going off. And, you know, it's very frustrating, especially in Med-Surg. You have other patients to take care of. One of the biggest things I try to hone in on is really teaching my new nurses that you don't want to quickly put them in restraints or quickly medicate them, giving them anxiety medications or Haldol or things like that. You want to take your time. Think about safety first. You know, we applied the chair alarms. We applied the bed alarms. What's next? Okay, if she's constantly getting up, let's maybe put her in the chair, move her closer to the nurse's station, give her something to do with her hands. Don't be quick to just give medications and things like that. Really think about what she's going through and do things to help the patient be busy. And actually that worked out. We gave her a vest. It's like an activity vest where we put the vest on her and she uses the strings to tie things, a different texture on different parts of the vest where she has different things that she can do with her hands. And that was something that was very neat to see, an activity vest that was given to her, and it kept her busy until the next shift. So we didn't have to medicate her. We kept her busy. She fell asleep. They were able to put her to bed. So that was just one good outcome of a dementia patient.
That's such a great story. It sounded like there was some really good advocacy for least restrictive interventions. Restraint should be your absolute last step after you've tried everything. Another thing in my experience that had been helpful to have more positive experiences in taking care of people with dementia is being able to try to replicate the routines that they had at home the best we can. And it definitely takes a little bit more effort and more time to talk to their family or their caregivers just to find out, when do they like to shower? Do they like to read the paper in the morning? Just some of those little things that are going to make them feel a little bit more comfortable, or maybe that they are in their home environment, and kind of keep that same routine, keep them happy.
It's quite challenging caring for those types of patients only because there's so much we're doing as it is. And you're right, you want to keep them safe, and I'm not advocating for restraints or chemical restraints or anything like that. But sometimes I need some real life solutions because I've got 5 patients I'm trying to take care of. I've got calls I got to make. I got discharges. I got admits. And sometimes you don't have the time. You don't have the time to sit there. I don't have time to call a facility and ask what their prior schedules may have been like, because I barely have time to get a report from the nurses that are trying to run out the door. So that's part of the challenge also. It's not that you don't want to provide it, but they do take a higher level of care than we have allotted to us. I think the nurse needs to care for themselves as well, because sometimes you can get really burned out and frustrated with those types of patients. And I feel like you don't want to take it out on them, because you're right. It's a lot of repetition. It's a lot of re-educating. It's a lot of everything. And sometimes it's okay to step back and say, I need a couple minutes. Help me out with this because I need to gather myself.
Yeah, Eric, I think that's a really good point. Nurses don't like to admit that we get frustrated or upset or even sometimes angry with patients.
We're going to pause for a quick moment to tell you about a special AMSN membership offer just for you through the end of this month.
Hey, Med-Surg Moments listeners.
We have an exclusive offer for you.
When you join AMSN by September 30th, 2025, using the code AMSNPOD,
You will receive $5 off your membership.
Visit amsn.org/join and be sure to enter AMSN-POD when you check out.
Okay, we're back.
Nurses don't like to admit that we get frustrated or upset or even sometimes angry with patients. It can be annoying when for the 10th time in 5 minutes they're getting out of bed, or you're reminding them, hey, no, you're not at home, you're in the hospital. But like you said, you got to give yourself grace and ask for help, especially because you do have other patients that you need to care for. So that's what your resources are, your charge nurses, your friends on the unit, your technicians that can kind of step in and say, hey, can you stand with them for a few minutes? And well, I just go check on this thing, or I need to step away for a minute. But I think sometimes we need to remember that dementia isn't a natural part of aging. There can be reasons why people are having an altered state of mind that we need to remember from the medicine standpoint. Do they have a UTI? Are they on a new medication that's interacting with another medication? Because they don't know why all of a sudden their state of mind is altered, and that can be scary and frustrating for them. And the families might not know that their meds or UTI or some other kind of infection can be why they're altered. And so we do need to try to get down to those root causes and go through everything instead of just being like, oh, it's another demented patient today.
I totally agree with you. I was just thinking about my patients that I've had, and it's difficult because sometimes you also have the family input, the families that are at the bedside. It's funny because sometimes at our facility, family members are allowed to stay under certain reasons, and for reorientation and dementia patients, they're allowed to stay, and sometimes they are helpful and sometimes they're a hindrance. Because I think, like Samantha was saying, sometimes I think they don't want to come to the realization that this is really happening and this is the new way of life and this is how mom or dad are going to be from now on. And that's a bitter pill to realize in bed A of room 605 when you're trying to just get through.
Eric, I agree with that. There is a denial part there. It's such a painful occurrence to see your loving parents who were once very strong and your rock, and now they rely on you. A lot of children who come and visit, they would say, I don't want to see mom like that. You know? But for them to understand that at this stage, this is what they need. The family is what they need, because the only way they can get back to their strong self is to identify themselves with their family members. I recall one of the family members. She was really desperately asking how can she help her mom. And I said, is there anything that she loves to wear? Any pictures that you can bring? Any journals? Any books? Anything that would remind her of who she was in the past? We always kind of like see, okay, what are the meds? What are the tasks that needs to be done for the day? But I think for patients with dementia, looking beyond that, she asked that question. I said, bring something that she loves to read, bring some family photos. And she brought a lot of her books and journals, and that really helped kind of get back into who she was. Although it's not coming together at all times, but then there were sparks of moments that she is able to see her mom again.
Yeah, it's true. It's kind of scary. Sometimes I think, oh, I'm the age my parents were when they had me. And I think, oh, there's that role reversal. Sometimes you're like, oh, God, now I'm the parent.
Right.
And it's kind of like shocking. Whenever I orient or have people with dementia patients that are so frustrated, they're like, I need to get out of here. I always say, pick your battles. Not everything has to be correct. I had one patient, came to the room and said, hi, my name's Eric. And she ended up calling me Ethan. And I said, oh, no, my name's Eric. She flew off the handle. Anger, aggressive. Oh, get out of here. Da, 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 da. I left the room. I counted to 60. And I came back and said, hi, my name's Ethan. My name's on the whiteboard. And the family said, oh, I thought your name was Eric. I said, when I come in here, I'm Ethan. And it made our stay that much more enjoyable. It's not always about the book. Pick your battles, people. If you need to be Ethan, be Ethan.
I love that example. I think another thing too, what I always try to keep in mind is trying to guess or find out what kind of music they liked. And if they didn't have family around, I would just kind of do some math and think about what decade were they in like their 20s or something, and pop something up on YouTube on our TVs and just kind of let it go. And it was always kind of fun. But I feel like that always kind of made a more calm environment for them as well, because it was familiar to them. And the movies that we have uploaded into our patient interactive system, they have a very wide variety. And I think it's kind of along that same line. Like you could pick an old Western, you could pick some sort of old black and white love story, but then they also have stuff from the last 5, 10, 20 years too.
I read in a journal that they said music actually is better than TV. You know, sometimes we put TV on for people to watch. And I guess the TV, it's too stimulating. It's too confusing because it's so fast and hectic. We don't have those fancy TVs with YouTube, but we do have music stations on our tellies. And that's what we try to put on for our people.
There's also a lot of vision changes that can happen as dementia progresses as well. And what I understood is they kind of lose a lot of the periphery and everything around. So they can really only see like what's like straight ahead in front of them. And so that could be along the same lines too. Maybe music is just better because then they don't have to like look for the TV or find it to actually engage with whatever movie or story is going on.
Imagine when we're at that age and they have to put stuff like,
oh my God, I can't tell you how many times I thought about it.
On that note, let's go around and have everyone share your biggest takeaway from this conversation.
My takeaway is really a lot of thoughts about being kind to yourself as nurses. It's a very challenging population, but it all starts within us. If you take care of yourself and you know yourself and how you can manage all the challenges, then things would be manageable. Music. Thank you for sharing that, because music therapy is such a powerful tool.
I think my biggest takeaway is definitely having more empathy and awareness of the family members or close friends of the patient who may be more in the denial stage of the patient's diagnosis. I don't think that's something that I've experienced before. Usually it's been more of the opposite, where they kind of are taking a break because they've just been working so hard caring for this patient and they're not maybe as present at the bedside. So I'd say that is my biggest takeaway.
My biggest takeaway as well is really focusing and taking the approach of giving these families empathy, giving them also the education for their loved ones, because there is a lot of support groups and a lot of pamphlets and information that they can really take to help their family members and help themselves in the process of seeing their loved ones go through dementia. And then the last one is involvement, is keeping them involved in their care, just like you all were saying, with bringing pictures, bringing memories, the journals, bringing those things back to the forefront of the patient to give them that reassurance and extra assistance with helping them.
Kellye, the activity vest that you mentioned, I've never heard of that before. And so I think my biggest takeaway was coming up with more creative ways to try to redirect and help before we get to that point of chemical or physical restraints. We all know the classic of giving them some towels to fold or something, but an activity vest or music or looking through pictures, the newspaper, whatever is going to help them be occupied or oriented to the present are all great ways to help us avoid to get to that point where they're getting overstimulated and frustrated.
I think one more that we didn't even talk about is baby dolls. I was just imagining our listeners being like, baby dolls, like listening in their car, like, they didn't talk about baby dolls.
The teddy bears.
And I'll share that's evidence-based. The use of baby dolls, they're evidence-based because they get back and feel like they need to take care of someone. So they got to be a stronger person again.
Oh, well, thanks, everyone. This was such a good conversation. To our listeners, thanks for joining us. We'll see you next time.
We look forward to connecting with you on the next episode of Med-Surg Moments, the AMSN podcast.
In the meantime, we encourage you to subscribe to Med-Surg Moments wherever you listen to podcasts.
To reach us, use hashtag MedSurgMoments on your social posts.
Or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We are all AMSN members, and if you love Med-Surg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the Med-Surg Moments podcast represent the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Eric,
Maritess,
Sam.
Kellye,
Marcella.
And Sydney. And always remember, Med-Surg Moments is a moment in our lives and a moment in our Med-Surg careers that makes a huge difference.